My name's Jan Cooper and I had decompression surgery 13 months ago. Well, the symptoms started, I just had trouble walking and I thought, oh, maybe it's arthritis because that is in our family. And then it just slowly got worse, and then my toes started to go numb, and then my stomach went numb. And that was, I really couldn't walk properly at all then. It was difficulty moving around, and bending over was a bit of a problem as well. But I just sort of plodded on, but with difficulty. I struggled to work. I don't know how I did it, but I did, because I had to get 2 trains to get there. But I just carried on. But I did have difficulty in walking. I knew something was wrong. I was having dinner, and then I got up and walked to another part of the room, and then turned around with all my legs, and all of a sudden hit the ground. From that point on, I used a walking stick if I went anywhere to make sure I didn't fall over.
Jan tried remedial massage, which didn't provide any long-term relief. Then her doctor sent her for some scans, which revealed her spinal cord was being squashed by a build-up of bone and tissues. She was referred to a spine surgeon.
Well, the surgeon said that I was very close to being in a wheelchair and that I really did need the surgery, but he could not guarantee that, that I wasn't going to end up in a wheelchair anyway. But if I didn't have the surgery, I definitely would be in a wheelchair. Things were pretty grim before the operation.
This is a true and common story. The spinal cord and its nerves run through a hole in the middle of each vertebra. A build-up of soft tissues or bony spurs due to injury, ageing or arthritis can cause narrowing of this hole, squeezing the spinal cord and nerves. This can occur anywhere in the spine. This nerve pressure can result in pain, changes in sensation and movement problems in the back and legs. The aim of decompression surgery is to improve walking ability, prevent further progression of muscle weakness and reduce pain. Decompression surgery is performed in many ways and may be called laminectomy, foraminectomy, foraminal laminectomy, or rhizolysis. Your surgeon will explain which is best for your condition. Generally, the procedure involves the following. An incision is made in the middle of the back at the level of pressure or injury. Muscles and ligaments are carefully detached from the bone and moved aside. Part of one or more vertebra is removed to help access offending tissues and to create more space for the nerves. Tissues pressing on nerves are then carefully removed, relieving pressure and reducing symptoms. The wound is closed to complete the operation, which usually takes about an hour. Possible complications of a lumbar decompression operation include, but are not limited to, wound infection, leakage of cerebrospinal fluid from your spine, deep venous thrombosis or blood clots, nerve root injury leading to movement problems, pain, changes in sensation or loss of function, reaction to anaesthetics or drug therapy, excessive bleeding, spinal instability, hematoma or bruising, epidural hematoma or bruising around the spinal cord, and compression of the spinal cord from surgical instruments. Some of these conditions are serious and ongoing, while others resolve over time. If you are concerned about possible complications, speak to your surgical team prior to agreeing to have the operation.
He'd explained all the, the things that could go wrong, and I was just confident that things wouldn't go wrong. Well, I went with a positive attitude. I had to have it done, and if I didn't, I would be in a wheelchair, and I couldn't picture myself in a wheelchair, so I wasn't going to be in one. I thought, well, I have to do it. I have to take that chance. So I just went ahead and had the positive output of the whole thing. Yeah, it took about 3 months from beginning to when I had my surgery.
Of all operative procedures, spinal cord decompression is one of the most successful operations resulting in community benefit. While success rates vary from patient to patient and depend on the circumstances of each individual case, research suggests 70 to 80% of patients will achieve good outcomes from this operation. The goal of surgery is to reduce pain by 80% or better. For patients with muscle weakness, there is no guarantee this operation will result in restoration of strength, but the goal of surgery is to prevent further weakness.
It's been a huge success. I mean, the outcome could have been very, very different to this. I don't remember anything until 24 hours after the op, when I woke up in ICU, and I thought I'd been in excruciating pain, but thankfully I wasn't. And I had the pain pump, which I didn't use all that much, so I really was very lucky. I was not in a great deal of pain, and it was under control. It had me walking in the hospital like day after the surgery. I could notice the walking straight, it was much improved straight after the op. I needed a fair bit of help at home when I first got home, as far as helping to shower and wash hair and things like that. 3 months after my surgery, I started with my physiotherapy, which was just building me up very, very slowly because of the severity of the operation. The rehab was very, very, very helpful, and he did stretching exercises and bending and showing me how to sit and stand properly and different ways to move. I just sort of took every day at a time. I mean, that's how you get through it. You just do it, and that's how it happens. That's how you get better. I'd say at least after the op, about a couple of months for the sensation to come back, particularly in my toes. It's back now and it's fine, yeah. I mean, I still have some discomfort, but I'm working full time and I'm getting around doing the things I used to do. The symptoms I'm left with now, I'd say, would be just a pulling sensation around the surgery area, and sometimes around my stomach and that, but I mean not numbness or anything like that. I mean, all the feeling has come back in my toes and my stomach. I can, do housework. Lifting, I don't push any boundaries. The physio had me lifting 10 kilos before I stopped seeing him, so I can lift 10 kilos, but I don't go lifting heavy things. I'm not going to tempt fate. Walking's no worries, no pain in walking. Up and down hills, that's not a problem. I walk at lunchtime at work and walk weekends. I would say just go in with a positive outlook, that things are going to be fine. Have faith in who's operating on you and looking after you. And just do as they tell you. And just take it easy, don't push the boundaries. Because if you push boundaries, you'll go backwards. The best thing about having the op is that I can walk. That's the main thing, I'm not in a wheelchair.